Well, the Multnomah County Sheriff's Office says they made a major drug bust this week.
Yeah, they tell us they took 92,000 fentanyl pills off the street after a traffic stop on Sunday. Deputies also found 10 pounds of meth, 3 pounds of cocaine cut with fentanyl. They arrested 23-year-old Easton Halleck and 24-year-old Tallulah Miroff.
And fentanyl seizures are up more than 1,000% from before the pandemic. Over 1 million pills seized across Oregon.
So Coin 6 wants to know, what can you do to protect yourself? Health officials say everyone should carry the overdose reversal drug naloxone. Brandon Thompson, live now from downtown with more on this effort. Brandon?
And medical professionals say they are seeing more of those drugs that are cut with fentanyl, as well as seeing families and friends with trauma after dropping their loved ones off at the hospital, suffering on the verge of death from overdose. Family and friends showing up at emergency rooms across Oregon with loved ones suffering from overdoses.
They pull in very rapidly and our ER turn around and often come in a panic, yelling, "I need help."
Their ages range from young to old. Jackie Chambers says typically clinging on to life.
I've been seeing an increase of incidents in both stroke, occlusion, as well as aneurysms between the ages of 16 to about 24, coming through emergency services and critical care.
Opioid deaths have nearly tripled since 2019, from 280 that year to 739 last year, according to the Oregon Health Authority. OHA says this year is on a similar pace from last. Fentanyl is fueling the increase. We've reported on pills marked as less intense opioids turning out to be fentanyl before, and these medical professionals are also seeing other drugs laced with a synthetic drug.
Bad outcomes for patients who have gone to parties or have gotten hold of pills, marijuana, as well as heroin and cocaine that's laced with fentanyl, and ended up with these strokes.
Chambers says in the worst cases, those patients die. Other times, the oxygen deprivation leaves them needing assisted care for the rest of their lives. The solution right now, pharmacist Anthony Tran says, is naloxone.
I think we would like to see it as commonplace as an EpiPen would be for someone who has allergies. And you know, that feeling of like, oh, should I have this? It's kind of weird. I mean, that's part of the work we're trying to do, of demystifying having something like this on board. And there are signs of an overdose to look out for. The medical professionals you just heard from told us that an opioid high can start off energetic, but as somebody becomes lethargic, that is one sign. Somebody struggling to breathe or sounding like they are snoring because they can't breathe is another sign, as well as graying skin. These medical professionals say if you see that, call 911 immediately, and if you have it, administer naloxone. Oregon has Good Samaritan laws that protect people who are administering naloxone if they are doing it in good faith. Reporting live in downtown Portland, Brandon Thompson, Coin 6 News.
Yeah, really a sign of the times that we would all be encouraged to carry an overdose drug to help save a life. Brandon, thank you.